Hello, this is Holland Chapman, and this is my drugs and alcohol research notes presentation. So, what is the type of drug that I covered? Well, the type of drug that I covered in my previous presentation is stimulants because they're the ones that sound the most interesting to me. As the word stimulation is just basically you're wanting to do something, and this basically is a drug that makes you very active, good or bad. So there are three different types of stimulants, since they're used in different ways. So the first ones are ones given as prescription medicines, like methamphetamine when it's not used too much, like it's used for like ADHD and that kind of thing. Some of them are used as performance enhancing drugs. I forget the specific ones, but they're used for doping reasons. And then stimulants that are used as recreational drugs. These are the ones that are like bad, like meth, crystal meth, cocaine, MDMA, nicotine, those ones. Yeah, those are three different types. So what are effects of stimulants on the body? Well, they can increase the risk of a lot of things. Through the abuse of cocaine, it can increase your risk of stroke and sepsis, which sepsis is like you're in a life-threatening condition from like a normal infection. Through the intravenous usage of cocaine, which basically means you get shot with it, you can increase the risk of hepatitis C, HIV/AIDS, infection, thrombosis, and pseudoaneurysm, which hepatitis C is infection that causes inflammation to the liver. HIV causes AIDS, which interferes with the body's ability to fight infections. Thrombosis is a blood clot in a vein or an artery. And then a pseudoaneurysm is a blood vessel wall that gets injured, and then the leaking blood collects in the surrounding tissue. With the inhalation of cocaine, you can get acute bronchitis and lung cancer. You can increase the risk of those, which acute bronchitis is an inflammation of the airways or bronchi of the lungs, and lung cancer is pretty obvious. And then through abuse of meth, you can increase the risk of Parkinson's disease. And the pictures are the left one's thrombosis, and then the one on the right is lung cancer. So what types of stimulants are most popular in America? Well, there's the five, or basically the ones almost everyone knows, which are caffeine, cocaine, MDMA, which is also called ecstasy or Molly, methamphetamine, which is stored in meth, and nicotine. And there's cocaine right there on the left, and then there's some coffee stuff for caffeine on the right. Yeah, and those are the five main ones. So what are health concerns of stimulants on the body? They can potentially give you any of these health concerns since they're not really good for you to consume in very large amounts. They can give you stimulant psychosis, paranoia, suicidal ideation, punting, mydriasis, arrhythmia, high blood pressure, hyperthermia, rhabdomyolysis, stroke, cardiac arrest, and seizures. And then for the explanation of some of these stimulants, psychosis is having hallucinations and delusions from consumption of a stimulant. Punting is just like prolonged and purposeless behavior for meth users specifically, so this one's like a specific kind of one. Mydriasis is just dilated pupils. Arrhythmia is either your heart is beating irregularly, it's beating too fast, or it's being too slow. Hyperthermia is the opposite of hypothermia, which means that your body temperature is too hot for what it should be. Rhabdomyolysis is it basically damages your skeletal muscles and they break them down rapidly. And one protein specifically, which is called myoglobin, can be harmful to the kidneys. It can cause kidney failure. And finally, cardiac arrest is the sudden loss of blood flow to the heart, which makes the heart stop pumping. The one on the left is arrhythmia, and the one on the right is rhabdomyolysis. So what's something that I learned about stimulants? Well, something that I learned about stimulants, it sounds kind of dumb, but I didn't know that nicotine was considered a stimulant because I thought it was part of the cannabis drug category for some reason, because you can smoke it and you can smoke weed, but it's not because it doesn't contain any cannabinoids. And as you can see, some things could take nicotine, which is like an inhaler, skin patches, chewing gum, lozenges, of course, smoking stuff, And then sometimes they have like prescriptions to help you with getting rid of your nicotine addiction, which is on the right of the right image. So what is something I knew about stimulants before researching about them? I did know that caffeine was a stimulant because I've heard about it before, and I could infer that caffeine stimulates you into being more active during the early morning of the day. I don't really know. I don't drink any of the stuff that has caffeine in it, like coffee or tea or red energy drinks or Five Energy or anything like that. I just know that it does since most people do just because of that reason. And you want to keep it in moderation, of course, because it's still a stimulant and it's still bad for you in very big doses. So, how to grow by researching this unit? I just learned more about stimulants than I could have ever known before the student projects, and it made me learn a lot about what drugs can do to you if you. Well, first off, you shouldn't really do the bad ones, but it's like if you do like caffeine, it can really damage you, which I'll go over in another slide if you have overconsumption of it. So, what was the myth that I busted? All stimulants are illegal. That's not true. That's not true at all. There's two prominent legal ones, which are caffeine. It's readily available everywhere. It's one of the main ingredients in coffee, not caffeine, coffee, and also nicotine. It's very restricted. It's like in Ohio specifically, you can only get it for 21 or older, but it's not illegal. You can still buy like cigarettes and snuff and all that tobacco stuff. Like I said, it's available whenever you have substances that contain tobacco, and there's some coffee, and there's some cigarettes from two very well-known brands of those types. So, how do I think Americans can be more educated about stimulants? Explaining them about caffeine intoxication, since almost everyone drinks coffee already. So, caffeine intoxication is a state of central nervous system overstimulation that can result during or shortly after the consumption of large amounts of caffeine. It can do a lot of things to the body, but like the most common ones are irritability of the brain, anxiety, restlessness, confusion, delirium, headache, insomnia. It can give you muscular seizures, trembling in the muscles, twitching in the muscles, overextension in the muscles. It can make you have rapid breathing, frequent urination, dehydration or fever, abdominal pain, nausea, vomiting, maybe with blood, a rapid heartbeat or irregular rhythm of the heartbeat. Skin's very sensitive to touch or pain, ringing ears, and like seeing flashes of stuff for visual effect. Like not visual effects, so like your eyes think there are visual effects happening. It can be treated if the patient is not dead from their intoxication. As you can see from the left, you can die from this. As says latest information, teen dies from caffeine overdose. Bags of pure caffeine powder found in home. Yeah, I forgot to link the YouTube video, but you can find it on YouTube. That's where I found the photo. And then it can be treated if the patient is not, like I said, it's not dead from the intoxication, but only by either two things. If it's a mild one, you can just treat the specific symptoms with relief. If it's severe though, you have to do something called hemodialysis, which is a process of purifying the blood of a person whose kidneys are not working normally. So you did that process on you to make sure your kidneys are working, because it goes through your bloodstream, so you have the ability to pee. Yeah. And as always, thanks for watching.